I worked with a group of women journalists at New Vision to create a new women's column. Now that doesn't sound like a health journalism project, but really when you look at the health problems in Uganda, many of them really at their root are problems that relate to the status of women. The very first one was by a young woman who wrote about why she had chosen to be a single mother, which in Uganda is a pretty bold statement to make. There's a lot of pressure on women to get married and to have a lot of children. Here's a woman who decided not to get married and to have only one child, and they're closely connected. She really felt that she could only have one child if she didn't get married because of the social pressure and the pressure from a husband would be so great to have more children. That's a really important health story because Uganda has one of the fastest birth rates in the world, and there are lots of maternal health problems, infant mortality, nutrition, education problems that relate to that rapid growth rate. There was a lot of controversy. There were a number of women who wrote back that they agreed wholeheartedly. There were some women who wrote that they passionately disagreed. And interestingly enough, one of the letters that came back from a woman who strongly disagreed, and she talked about the virtues of motherhood. We contacted, the journalists at the New Vision contacted and invited her to write a column herself. We really want to encourage women who are not journalists to write for this particular feature. And here's one who wrote in reacting to one column, and we're getting an entirely different column on an issue that once again really goes to the heart of the status of women in Uganda. And I think the most important changes really will only be seen, in a generation.